Well, hello, everybody. This is your advocacy team reporting from Topeka. We're not actually in the State House, but we've been watching them all day on Zoom. And our leader, I think, is having dental work today or something. So a couple of things I was watching for Senate Bill 208, which is the bill that would prohibit transgender females from participating on transgender teams in K through 12 and in higher ed, was scheduled to be worked on today in the Senate Ed Committee, but it was not. So, but the Senate chair, the chair of that committee, Molly Baumgardner, said next week we'll be working bills. So we expect that that bill will be probably worked on as early as Monday. Another thing, the Senate Ed Committee did receive what is going to be an annual report card on how children in foster care are doing in our K through 12 system. You know, they are not doing well. So this first report looked at some graduation rates, looked at state assessments. It said the foster kids graduated at about a 61% rate, which is 28 points below what the average, what our graduation rate is, and children in foster care services were scoring in the lowest level on our state assessments at almost twice the rate of other students. So obviously, this was the first annual report. This was a report card that was put together by an executive order by the governor. There was also a bill in the legislature to kind of put this in state law. Obviously, legislators and of course everyone in the education community is interested in this. And so the feeling is now we have this information. What do we do with it? So those were kind of the two things I kind of followed today. Leah, you testified on a bill, and I'll let you talk about it.
I did, Scott. I testified in House Education on Senate Bill 62, which we support. It sets up a commission to oversee vision screenings in Kansas public and private schools, and does not really put any onerous burdens. It doesn't add any additional requirements. It just kind of sets up an oversight committee, and I think sort of concentrates some of those vision screenings a little bit earlier in the elementary school years. I think with the intention of helping identify some vision problems early before they start to seriously impact children's ability to learn. So we support efforts to improve student health and safety, and so we appeared in favor of that bill. It's already passed the Senate. Similar bill has passed in the House, so seems to be heading right along. So as you all know, we are tracking the legislative budget efforts here in Kansas, and we've heard a lot of chatter about trying to use federal funds to replace, or as we sometimes say, supplant state funds in the state budget. And Scott, I think we heard something today that our members would like to hear more about. So why don't you cover that for us?
Well, thank you, Leah. It's kind of, what happened was Senator Renee Erickson in the Ways and Means Committee, which is the Senate Appropriations Committee, basically, she moved, and they agreed to it, to take out the high density, at risk, and state aid for LOB funding from the Kansas State Department of Education appropriations bill. Take it out. Let's talk about it during the omnibus session later. And she said we need to have a discussion about whether we can use federal funding for that. All indications that we have heard from both at the federal and state level is that you cannot do that. The federal government COVID-19 relief efforts have a maintenance of effort clause, basically saying schools, you got to fund things the way you were funding it. This is additional. This is for COVID-19 expenses. And I think that's how KSDE interprets this. And that's obviously what we're going to be telling legislators as we go forward, not only because it's important that we have this additional funding for COVID now, but this money is going to run out at some point. And then the state we're going to be looking at budget cuts, or the state is going to have to increase funding a lot. So that's kind of the issue around. Is there anything you'd like to add to that, Leah? Or
No, just as a point of interest, President Biden did actually sign that latest COVID bill this earlier today. He had originally planned to sign it tomorrow, but he went ahead and signed it today. So that starts the clock running on all those stimulus checks that folks are looking at, and it will help us get, I think, even more information on how this might affect our supplement versus supplant debate. I think, as Scott noted, the folks that we know at the state level don't seem to think that's allowed by the bill, and some preliminary research that I'm doing on the federal level also indicates that, as Scott kind of mentioned. So I guess the legislature is hoping that, when they take their April break, by the time they come back, then end of April, beginning of May, some of this will have been, sort of officially ruled on, and then they can decide whether they actually want to try to spend that federal money instead of state money for things like the KSDE budget. So certainly an interesting development today, and we know it's been talked about on both sides of the rotunda. That means in the House and the Senate this session, about using federal funds to sub in for those state funds, and so we'll be keeping track of that and of the various budget machinations that might bring those two houses of the legislature together in some sort of budget bill for the next couple of years.
So yeah, we'll be talking a lot about that also tomorrow. Our advocacy update is at noon, so we'll probably be talking a lot more about the federal funding and some of the bills that are kind of popping up in the legislature. So I guess that's it for the evening.